my name is Stephanie Mulick. I'm an optometrist at Tayani Institute. Starting here is basic step 1 of Nextgen. We're going to start with the home page tutorial for you with a test patient here. A patient, which this is a test patient, and you should see the date of the encounter should match the date you're seeing the patient. And also when it's checked in, there's not going to be anything underneath the encounter yet. So basically you highlight the date, you go to this little template square, click on it, you're going to hit your home page OPH, and it's in your preferred because you already added that, as was shown in the prior video about how to change your preferred templates. So you go to your home page OPH for ophthalmology. That's what the OPH stands for. Now all of a sudden you can see under the date of August 22nd, 2023 that you have a home page open. Now when you're in the home page, you have all these different tabs. You have a little picture of a house, an intake, histories, preliminary, provider, assessment plan, finalize, and checkout. So we start with the little house. And why is that going down? So let's see, here we go. Okay, so the only thing I need you to do in the house is you're going to say who you got the patient information from and if it was established or new. This should pop up automatically. It already knows it's established because there's more charts. And the historian would be the self, would be the patient's giving you the information. You can also do your medications and allergies on this page. There's multiple ways to do them, but on the little house, you can talk about medications. It's a good thing to do first. You click on Add Medications, and when it opens, the main thing you're going to want to hit is this medication history. So, medication history has not been requested, but you are going to request it, so you hit yes. You can change this. This says in 3 years. Maybe you want to do it in 2 years. This is not going to pop up anything because this is a test patient, but if you hit accept, then it takes a little time. And if it was an actual patient, all of a sudden you would have some medications. You would hit reconciliation, and then another tab would pop open showing you all the medications, and you would hit confirm. Once you've confirmed, you can actually exit out because all the medications will be in the chart. If the patient is not on medications, you must click No Active Medications. This is important because if you don't click it, which I'm going to do right now, and I'm going to exit out, then when you look up here under medications, there's this big blue question mark, and that shows me that it hasn't been asked. So another way, other than hitting add update here, you can also just click on the medication where it has that big blue question mark. And if they're not taking medications, or again, if they are, you can pull them in through medication history. If they're not, you can hit no active medications, and a little check mark will come. And all of a sudden, the medications now doesn't have a question mark, but it says 0. You also want to make sure that you hit medications reconciled. It just means you went over it. Now, let's say a patient is on a medication and you weren't able to pull up any history, which occasionally happens. You can go into Prescribe New. This will also be the same way you're going to prescribe a medication as well as add a medication into the patient's chart. Prescribe New, we're going to say the patient is taking latanoprost, and we're going to click latanoprost eye drops, and for the eye drops, we are going to have, whoops, sorry, my screen's so small. You're going to put your quantity, so we can say 5 milliliters. If you're giving it to them, you might want to say 3 refills and make sure that it's correctly. This says install 1 drop ophthalmic route every day into both eyes. Typically on a latanoprost, we kind of want to edit that. I would personally write instill 1 drop into both eyes again, that's based on what the provider wants there. So once you're done, you hit done. And because my screen is so small, you are going to hit accept, and it puts it in. Now let's say it's a medication that is unrelated to eyes. Let's say the patient's on aspirin. So we're going to just hit aspirin. And then you're going to put in the aspirin. And let's say they're on a baby aspirin. So that'd be like a 81 milligram. We're going to put that in there. Hit acknowledge, and then we can hit done. So once that's in there, you just want to hit prescribed elsewhere and then accept, and it'll add that to the patient's chart. So that's how you add medications. If you wanted to prescribe a medication and send it to their pharmacy, then you click in the medication and you're going to hit send. Once you hit send, it's going to give you a window, and you can click on the little dots here and add a pharmacy. We'll say CVS. I'm in Oceanside, so I'm going to click Oceanside, and you can see all the pharmacies in Oceanside. And then once you do that, if you click this is the patient's default pharmacy, it'll always pop up there, and then you can hit send. I'm not going to hit send because this is a test patient. Once you do send the medication, you should be able to see it under this dispense history. You can click on it if it was blue, and it would show you if the medication was sent properly to the pharmacy. Okay, so that is the medication, and we are still missing the allergies. So same thing, you can kind of scroll down here. You see there's allergies here. You can hit add. It'll pop up the screen for allergies. I'm going to show you one more way. If you, again, you look up here, so now the medications say 2 because we just put in 2 medications, but the allergies have a big blue question mark. So if you click on the allergies up there, it'll take you to the same window where we were just at. If you click no medications, the little blue question mark just turned to a 0 because there's no allergies. However, if there is an allergy, you're going to go to the magnifying glass, and we're going to type in the patient has a penicillin allergy. So you type in penicillin, you don't have to write the entire name. You can get a few letters and it'll pull things up for you. So we hit penicillin, and then you're going to hit add, and now all of a sudden you can see under allergies there's a number 1. That means it added the allergy to their chart, and we're all happy. We don't want there to be a question mark on allergies or on medication. That shows us it was never asked. Okay, so we go back to the little home page, and that is basically all you have on the home page on this patient. We don't have to take vitals. Sometimes if the patient's been here before, you will actually see different complaints from the time that they were here before, and there might be more information here. Since this is a test patient, there's not a whole lot. But the other thing you can see here, which is interesting, but you can see it on other pages as well, is the last time the patient was dilated. You can see the last time their pressure was checked. This one was never checked, so there's no date, but if the pressure was checked, there would show up a date, the last time they had a refraction or visual field or photos, and so on. You get the picture. Okay, I'm going to say goodbye for right now and come back to another video for the intake.